Ready?
Yeah, go for it.
These care home workers have already received their jabs. But should COVID vaccines be compulsory for all? Today, the government said it will look at whether staff working with the elderly in care homes should be required to have the vaccine to protect residents from the virus.
I'm being very clear here. It's not a condition of employment, it's a condition of deployment in terms of you're coming into contact with very fragile, frail people who, if exposed to COVID, could likely kill them. Then it's only right and it's only responsible for us as a government to consult on this.
Scientists say 80% of staff and 90% of residents should be vaccinated to provide protection. Yet only around half of care homes in England are meeting this threshold. But some say care home staff are being unfairly targeted.
We know the transmission is not specific of whether you're in a care home or a hospital or in a shop or a street. It would make our workforce feel better that we're not being singled out. And this is about the whole of the health and social care sector.
A major UK study is now looking at whether vaccines can be mixed to help the rollout in the future. The trial will involve 1,870 volunteers. Researchers are now looking for adults over 50 who've had one dose of the AstraZeneca or Pfizer vaccine in the past 8 to 12 weeks. They will then mix and match 2 vaccines out of 4 available to them to see whether combining jabs in the second dose could increase immunity to the virus.
If we're not locked into giving the same vaccine for the first and second dose, then we're much better able to cope with any variations in supply or problems with supply or changes in recommendation. And that applies not just in the UK, but globally as well.
These long queues at a COVID testing centre in Clapham today are proof that the virus hasn't gone away. 4 London boroughs have now introduced surge testing after cases of the South African variant were found. As the lockdown eases, the message remains the same. If you get offered a vaccine, make sure you take it. Layla Hayes, 5 News.